I'm sitting here today with Dr. Erik Peper, and he's Professor of Holistic Health at San Francisco State University. He's also the author of a new book called Tech Stress. And I came across Dr. Peper quite a few months ago in relation to the field of breathing. And I have to say his blog posts and what he's written, his articles, we totally identify with it. And pardon the pun, but it's a breath of fresh air to have somebody involved in academia who has an interest in breathing, because normally breathing is not sexy and it's not taken into consideration, and it's very much overlooked. And I would like to thank you, Erik, for helping to shed some awareness of it and your interest in it. A little bit of background on yourself. Can you tell me why you got into holistic health, where breathing plays a role, and we'll take it from there.
Sure. I think my interest in holistic health comes really from failure. And I mean in the most positive way. I mean, I was intrigued in voluntary self-regulation of body. And for that, we used a tool called biofeedback, where we measure muscle tension or hand temperature. And you could see on the screen. And it was very clear that we were totally unaware of what's going on. It's just like as you're listening, or if you look at something, you may be holding your breath without awareness. And it was those pieces that I said, hey, how can we teach more awareness? And then when I start to work with clients sometimes, or with students, then I realized that, we may offer some medication or do something else, physicians, but that was only part of the puzzle. Health is the way we relate to ourselves, it's our thoughts, it's our environment, it's our family system, it is our social network, it's our diet. And right now, I would say the foods we eat in the United States, especially our Western diet, highly processed, sets us up almost for pathology. So you need to account for all of that. And they interacted with breathing. That's what people didn't know. So let me just do a simple experience, how quickly we may be affected and how breath is affected. And that's how I got intrigued, basically by observations of self-awareness, seeing it in others, and then all of a sudden realizing, wait a minute, in the history, breath is really the boundary between consciousness, unconsciousness. It's the boundary of being alive or deaf. It is the expression of emotion, and we don't see it. Yet our language is filled with it. Some of you are waiting with bated breath whenever Patrick does a podcast, and others will give a sigh of relief when this is over. But notice this represents our emotional states. It's even more than that. When you go to the healthcare, to a healthcare provider, they don't look at you in terms of breathing. They don't ask. Well, they do. They look at gas exchange, very important right now in COVID-19. They look at blood saturation. They may look at pulmonary airway, how much volume you can inhale or exhale, or peak flows. That's it. And yet, if you really look at people, you realize that's only one part of it. Some of us breathe in our chest mainly. Some of us breathe in our stomach mainly. Some of us hold our breath. Some of us breathe through our mouth. Some of us breathe mainly through our nose. There are many different, all those are not looked upon. All we look at is rate in psychology traditionally. And then we get an error because what we consider normative rate, 18 breaths often in nursing, that may be too high. And so it's these kind of patterns. And then you see the observation with clients or students, those who have GI distress, this menstrual cramps, it makes no difference, irritable bowel, almost all the people, or those who are anxious, almost all, without knowing, tend to hold their waist tight, the abdominal tight, they shallow breathe in their chest. And if you think about it in terms of a metaphor, it's like a posture of fear. And I don't mean it. When I'm afraid, I go, I don't know I'm doing that. So let me do two exercises to show the importance of breath, if that's okay. So as you're sitting here, or don't do it while driving, by the way, but when you're sitting and listening, for a moment, I'm going to make a click. And with each click, I'd like you to look to the extreme right and then to the extreme left. You ready? Get set? So let me illustrate. If you looked at me, When I hear a click, I go right, then click left, and back and forth. So let's do this. Ready, get set, go. And are you holding your breath?
Yes.
But why are you holding your breath? If you think about it, I'm holding my breath. And when I hold my breath, I am freezing in space. That may be useful. I'll talk about that. But I'm really compromising my oxygen exchange. I cannot get rid of the carbon dioxide. And yet we were totally unaware that we did this until someone notices it. These were kind of the beginning pieces of how I started. And then we do research on these areas. And then when we monitor people, you see they do this or they breathe shallowly in their chest. Going back, why did you hold your breath? Well, without awareness, you were responding naturally from an evolutionary survival mechanism. There's a tiger way over there, or a predator. I don't know it. So what I do is I freeze. I don't move. I don't even blink, because when I blink, I may lose where the predator is. I don't move my chest or my body, because if I do movements, I am more visible on the retina of my predator. I don't even know I do this. Now the same response occurs when a scene change occurs on my screen. When I meet something novelty, I hear a loud noise, a notification. And after a while, this becomes the conditioned response.
But
we don't know it.
My question there is, in terms of eye movement, how is it just a natural reaction? Obviously, you knew this. I've never done that experiment before, but I was holding my breath during it. When I was moving my eyes to right, left, and following your command, was it the utmost concentration that was doing that? Because I'm not in a fight or flight response at the moment. So I can see it might be a little bit different if the tiger was off in the distance. Yeah, that's a different story. Is it a natural reaction when we are applying all of our attention that we unknowingly hold our breath?
It is a component of that attentional process, or startle. And the reason I'm saying cannot be totally attention, because if you held your breath too long, after a little while, your cognitive activities would be breaking down. So it would not be functional. It's only useful for that moment. The way I look at it is that this is the evolution, the survival mechanism. The pattern which through evolution, if I responded this way, my genes would survive, more likely. If I didn't, they wouldn't. Now what happens is I just did the inverse. I just made your eyes move that way. And that becomes the condition cue to trigger the other patterns in our body. Not much different than Pavlov's dog. You have the meat, the dog salivates. Salivation would now be breath holding. Now I ring a bell, and after a while, the bell will trigger the salivation. And that pattern I see in many different ways. So we forget. And that's maybe the holistic perspective, the mind-body perspective. Overall, in psychology, we take people from the neck up, I'm sorry to say. We tend to think of their thoughts. The internist takes you from the neck down, a little bit exaggerated. And the clergy may take anything that floats around. That is not totally.
That's a good analogy, though. That works for me.
And then you have the social worker who takes the social, but it's all together. What we have forgotten, and it's coming back, it isn't just thoughts that affect body. Body equally affects thoughts. They're not separate. And let me do that by another little experiment, if that's okay, which we have published. All these have been published with different data. And this came about because in terms of hyperventilation. As you well know, when people hyperventilate, the carbon dioxide level goes down. You get all these symptoms. In the extreme sense, the blood, even the cerebral arteries constrict, the coronary arteries constrict, your hands get, or you go into tetany. The trouble is that in a clinical practice or of students, I almost never in my life see somebody like that.
Yes.
However, I see something different, and I get the same symptoms. And so let me take you through that little exercise, and then observe what happens. Okay. What I'd like you to do in a moment is just breathe normally like you're doing. The only thing you're going to do is to exhale about 60 or 70% of the previous inhaled air.
Mm-hmm.
So that's a subjective measure. So I inhale, I exhale 70%, then I inhale again, I exhale 70%. I keep doing this.
So it's like breath
So let's
stacking. Breath stacking.
Yes. And so let's just do that for a moment. Are you ready to do it? Start. So with each breath, you don't exhale the same amount of air you inhaled, you exhale less. And you keep doing each breath that way. Keep doing it. 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 Keep exhaling only less than you inhaled. Keep doing it. Keep doing it. Keep doing it. Keep doing it. I think that's probably enough, about 30 seconds or so. It must have felt like at least a minute in the one hand for most people. And then the question is, what did you experience?
Well, I just felt that my lungs were absolutely full at the end, in terms of, because I was almost hyperinflated like a balloon. I was starting to feel a little bit lightheaded. Yeah, it was a bit off. It's a little bit foggy in terms of the mind as well.
Yes, and if you do this as a study, and you have had a lot of experience with training and breathing. If you do this with students, with clients, the Jaffer, what you see is about 30 to 40% will at least, or almost most of them, in fact, much higher, will report some increase in subjective sense of anxiety, some fuzziness in their head. You know, all of a sudden they're not as clear. One or two, not too many will get an ache all of a sudden in their chest or whatever. It's most interesting. They get all these cognitive, emotional symptoms almost, which are similar to those of anxiety, panic, etc.
Yeah. Is it a little bit like producing with the hyperventilation provocation test? Is it along similar lines, is it?
Yes, but the key is, when I looked at you, if you look at most people doing this, you would never even know they're doing it. It is not if I do hyperventilation, I go,
yes.
It is so mild. But really, it's a kind of incomplete exhalation. It's almost like I'm a little bit, the analogy is fear. Let me put it that way. If I'm afraid, I tend to gasp, and then I shallow breathe on top.
Yeah.
So I've just taken that same evolutionary pattern, amplified it, and all of a sudden you see that they get many of the same symptoms, but yet if you really are honest to the carbon dioxide is building up in the bloodstream.
So during that, the carbon dioxide is increasing in the blood, but yet it seems to be producing symptoms of hyperventilation.
Yes, and they match perfectly the Nijmegen scale. It's the most interesting part.
Sorry there, because this is where it's getting interesting. Well, it was interesting anyway from start, but so the symptoms, because in the 1990s, Hornsveld, you're familiar with that study whereby he got individuals to do the hyperventilation provocation test. He produced their symptoms, but their CO2 levels weren't necessarily low. So there's a behavioral mechanism that is producing symptoms so it's not entirely carbon dioxide. There's something else going on.
Well, I would argue, that their study has some flaws in it from my perspective, but I haven't looked at it for a while because I used to go to those meetings each year, those respiratory psychophysiology meetings, and that study killed the field in some sense.
Yeah, totally.
And they were totally wrong and right. They were right maybe that it isn't always carbon dioxide levels, but it's clear. At Stanford, they showed that if you monitor people with panic attacks online when they have it, that the PCO2 goes down. So I think the Dutch study was incorrect. And yet, if you think of it more as like I did before, about the looking to the right and left, it's a classic conditioned response. Then all you're doing, you're putting the person into a state that evokes those past experiences, and you have the same symptoms. That's how I looked at it, that we are really conditioned. And this comes right back to the earliest work in asthma, one of the earliest published studies, where you take someone who is allergic to roses. This was done in the late 19th century. You then give the patient the paper rose and they react. And they get this asthmatic attack. And in many studies done, you can show that probably 50% of asthmatic episodes are at least triggered by these kind of conditioned patterns. It doesn't mean it isn't real. The body reacts, but we react the same way. Just think about it as you're sitting. And I think people forget how powerful the thoughts and images are, except we're not aware we're doing that. If we are walking down a street and we walk past a house and has a unique smell, and that smell reminds us of our grandmother, all of a sudden we are flooded by those memories. That smell. The same way, if I hold body posture, we evoke it. So let me take that concept even further experientially. As you see, much of my data initially comes from a sense of experiential, and that comes because how do you persuade people that breathing is important? If I just talk about it, they look at me and they say, it's breathing. If I do a workshop on respiration, who shows up, right? Very few people, realistically. It is not that exciting. But if you can say respiration or how to improve your IQ or social performance or whatever it is, make it exciting, then maybe people will.
Yes, but you can improve your IQ. And I would absolutely believe that by changing breathing patterns. So, yeah, I agree with you.
Yeah, and so by doing these little mini exercises, they're always A/B. It's you do one way or another, and then you can say, something happened. It's like this breathing pattern we just did, the exhalation one. If you experience those symptoms, then you can say, and if you have anxiety or other symptoms, and they got aggravated by this little exercise, then maybe if you change your breathing patterns, at least you wouldn't aggravate that. I am not saying there are not other causes at all, but the data, so that's the logic. It's a kind of non-verbal teaching. And maybe that came about because English is my second language. And I was born in the Netherlands, and when I came to the United States, I was 12 years old, I knew no English. So then I had to use non-verbal cues without awareness to identify what's going on. And maybe breathing is one of those cues. And it's central to ourselves. And now think about it when people sit at the computer. When you're sitting, everybody tells you you're supposed to sit nice and straight up. I don't know many people who do that for a long time, because if you do, your discs compress more and more and you get tired. So what you do is you start slouching. As you start slouching, your head goes forward because you can't see the screen. And the other part is, many people have gotten symptoms when their ergonomics have been perfectly arranged. That's how I started in this part of at the computer. We had people who had seen a great ergonomist. They arranged the chair perfectly, the keyboard, and the person continued to have symptoms. When you give somebody the right chair, you only give them the opportunity to sit correctly. It doesn't mean they will. If you give them a lousy chair, and that's the same thing with breathing and body patterns. And the other part was, when we did all these different studies, when we used words that didn't always work well, it was quite challenging to explain it. So we need to give people experiences to feel the difference. So let me do one at the computer, although it's a little different. You're sitting at the computer.
I'm standing, but I don't know. I stand at a computer, so.
Great, I'm gonna stand too. I have a desk which I alternate. Thank you for reminding me. So now I'll go up. My desk is now going up.
Mine isn't as quite high tech as yours. I have to push mine.
It makes no difference. But as a side note, now when I'm standing and I now start walking in place, the most interesting phenomenon occurs, because when I walk in place, my calf muscles are tightening and squeezing, and they are bringing the lymph back and the venous blood back, and they reduce the load in my heart. And what people often talk about the calf is called the second heart of the body. But And when you stand, you're going to be able to breathe more easily, diaphragmatically, because when I want to be socially acceptable, my belt needs to be tight. So enough that it doesn't sag down. But what people forget is that many people constrain or cannot breathe diaphragmatically easily because they have designer's gene syndrome. That's the term we use. Their belt is too tight. And this goes right back to the 19th, 20th century when the women wore these corsets. And when the women wore the corsets, mainly upper class, then many of these women developed a disease called neuroestemia, which is this well-known disease where people, what we now call anxiety, they get all the hyperventilation syndromes as one, they get GI distress, they get wandering uteruses, whatever that means, they get operated on. And the only reason that occurred, and people were totally blind of that, is that they were wearing a corset which constricted their abdomen too much, that not allow the diaphragm to descend, and they were in problems. And one of the biggest, as I think about it, we think of breathing only as gas exchange, going back. Breathing has multiple functions, we forget that. It is, if we breathe, call whatever natural means for a moment, as we inhale and exhale, our spine slightly moves. So it's almost like a massage of the interdisc. That's one. Two, the much more important one, when you're comfortable and relaxed and feel safe. Being safe is critical. If you're not safe, it's harder to breathe in an effortless, regenerative way. Breathing means the diaphragm needs to go down when you inhale. In the vertical position, it literally takes no effort because gravity assists the downward movement. The lower ribs widening. You describe that better than almost anyone else I know in this world. It also means your pelvic floor relaxes in the inhalation. The transverse and oblique muscles relax a bit. Then when I exhale, the pelvic floor tightens slightly. It comes up. But all of a sudden, when you think about this pattern, breathing now is the pump that allows blood circulation to be optimized in the abdominal cavity. It allows the lymph returns to occur in the abdominal cavity. And even the vena cava will change its size by 1 centimeter or more. You can only see this if you take a yogi who isn't scared and then test them in an MRI or so. But if you take normal people, they're scared.
With diaphragmatic breathing, you're seeing an increased return of blood flow to the heart.
Yes.
Which in turn then is increasing stroke volume.
Correct.
So in essence then, there's less effort on the heart, or less energy may be expended by the heart in terms of breathing when we are using our diaphragm. And the other thing about lymphatic drainage, maybe people mightn't be aware of that. For example, we've had people come in with irritable bowel syndrome over the years, and I've seen changes there. And I have no idea how is it happening. Maybe there's multiple reasons why it's happening. I thought typically that maybe we're helping the person to relax. So we're getting a better balance in terms of parasympathetic, sympathetic balance. But there's likely to be other reasons, including movement of the diaphragm in massaging the internal organs. What are your thoughts on that? Just going through a few aspects of it.
Well, we've had a number of experiences with students who have had 8 or 10 years of irritable bowel or acid reflux. Yes. And I'm lucky that these are obviously younger students. They're college students. So maybe the disease has not yet progressed such pathology, but some have been very sick, but they come obviously not because they are sick. They come because they're a student and they happen to learn these techniques. So it's a different framing as well. Because so often you think of all of me as sick. No, only a part of me has a sickness, most of me as well. So what is going on? But the common theme of each of those is that many of them have their waist constricted. They don't know it either by clothing. They wear tight pants, tight belt. They wear tight underwear, whatever it may be, to slim them out. That means the diaphragm cannot really descend. That means by definition, when they inhale, the diaphragm tightens, that causes the lift. They have to lift their ribs more. They get more tightness in their neck and shoulder. And usually the volume per breath is much less, although it feels like more.
A shallow breathing.
And then on the exhalation, they have this more sigh-like response. It's much too exaggerated, but I'm talking. But the major part is, in doing that, you could say their body is put in a slight fear reaction. Think of it that way. If you do, you automatically, the peristalsis of your GI tract is affected. Blood flow goes away from regeneration, the internal organs, to your deep muscles. So that is the kind of overwhelming philosophy. And then when you breathe easily back and forth, then it becomes the pump that allows the venous return and the lymph return to come back. And what we have observed with many of these students and clients, when they learn to breathe diaphragmatically, the first thing that happens, they get barbarismus. You hear noises, stomach noises. That is the reestablishment of the peristalsis. That's the best thing. And they are embarrassed. Oh my God. But really, that is okay. Then if they really practice this, they notice their discomfort tends to go away. And then they're still sensitive. Many in my experience of these participants are very sensitive people. They're sensitive to emotions. They're sensitive to the environment. They haven't quite learned how to not react as easily. They react automatically almost by tightening their gut to pull in to protect. I'm exaggerating. And then they have learned not to show it to anybody. It's an exaggeration, but but they usually will say yes. And then we teach them to breathe lower, and then they become aware, when something happens, I'm tightening up. And then they have to do these interventions in the daily world. And when they do that, it's been remarkable. I mean, we have published a number of cases where this goes on. Let me do one more different one on acid reflux, where it's obvious. Okay? The classical medical treatment there are many. You have medications, and it depends on the severity, I know. But the first thing that's often done is tilt the bed so the head is higher than your feet. What you're doing is really, you're trying to get the weight of the abdomen being pulled down towards your feet. The reason you're doing that is because if you think of the body, you have the diaphragm as a dome. Underneath it is the stomach. And then underneath your intestines. And if you now think of purely weight, if you're pushing on the abdomen, then you push against which pushes against the intestines, that pushes against the stomach. And if the valve is very weak, then it pushes the stomach content back into the upwards. And that would get the irritations, the acid reflux. One of the things almost all these participants I've ever seen breathe mainly in the chest. There's no abdominal movement. The lines are unbelievably clear. You put a strain gauge around their abdomen and around their chest, the bottom has almost no movement. The chest has lots of movement, often much too rapidly. The analogy we do is as follows. If your belt is tight, it cannot expand. Most people think breathing takes place in their chest. In fact, yes, air exchange takes place in the alveoli, but the alveoli can expand most if the diaphragm goes down. That really means the abdomen is almost a metaphor for breathing. So the lower ribs widen, the pelvic floor goes down. That is so it's much better to think of your breathing as a ball in your abdomen. Now what they are doing, so now they're holding their abdomen tight. Now they're trying to inhale, but when you inhale and the abdomen is constricted, you keep applying pressure onto the abdomen. It's like a balloon. Now you're squeezing it. The weakest part pops up. In this case, it's that valve. It pops up. If all you do is teach these people to relax their abdomen and do this back and forth, they do so much better. I am not saying that's the only thing, but from a holistic perspective, the question is, how can you teach people health promoting things they can do themselves? And at worst, they're wasting their time.
in terms of the literature, it's been shown that 75% of anxiety and panic disorder have dysfunctional breathing. And it's pretty much characteristic of how you're describing it there. The biomechanics are incorrect, the biochemistry is often incorrect, and the person is just breathing a little bit faster, a little bit shallow. And to a person, to a healthcare practitioner who's not experienced with breathing, they won't even spot it, they won't notice it. But in terms of activating diaphragmatic breathing, would you mind contributing how, because I have my own take on diaphragmatic breathing, and it may not necessarily agree with yours, but I just kind of give you my own aspect of it. I don't feel that people can adequately engage their diaphragm unless they breathe through their nose. And there are very few studies on it. I know there was one meta-analysis done. They looked at 18 studies and they said that few, if any, studies did not find there was a negative impact of mouth breathing on respiratory function. That diaphragmatic engagement is reduced during oral breathing versus nasal breathing. Now, the thing that intrigues me most is that when we think about the disciplines of physiotherapy and physical therapy, there's all the talk about engaging the diaphragm, but very little talk about restoring nasal breathing. So that's one aspect of it. The other aspect of it is that traditionally we were getting our students coming in, that as they breathe in, that they push their tummy a little bit out, and as they breathe out, they draw their tummy in. And then I realized, of course, that that's not the right way to do it, that we should be looking at lateral expansion and contraction of the lower ribs. So I'd love to hear your take on it. How would you, say for instance, any of our listeners, is there any simple techniques that they might be able to take home in terms of achieving more diaphragmatic breathing?
Well, I think the first thing to remember, ideally, breathing is effortless when you're healthy. When people report effort, usually they report the effort in inhalation, interestingly. Almost nobody reports exhalation. If you work with people with asthma, they say, I can't get air in. That was our start. How can you now first exhale? So we often do that. And the question is, how can you master this? It is not will. I hate to say it. You know, you can use gimmicks to do it, to reactivate the muscles, the person to feel it. And there's another piece in this before I go on, that however you're breathing, however dysfunctional you're breathing, it feels okay. It feels correct. And the moment you teach somebody else to shift their breathing pattern, it feels not quite right in the beginning. It's no different than if I stand slouched like this, and now you tell me stand up straight. I feel myself being straight. I stand up. Now I feel like I'm falling backwards. Breathing is just like that in that sense. How to teach breathing. How to act, or maybe I want to say when I teach breathing, I want to initially focus on the exhalation. Because that's what people tend not to want to do. They want to all inhale more. Now there's a reflex of the pelvic floor and breathing as well. So if you purse your lips, I agree, as a side note, I agree totally that people should breathe in and out through their nose. I make a separation sometimes by teaching you awareness or skills when it's easier, because we sometimes have more difficulty controlling the exhalation flow through our nose, even though it goes slow. We have a slightly better control if we can go through pursed lips. So often I may, if they have no sense, I could say, okay, do a pursed lip, kind of. So you can feel your anus tightening. You can exaggerate the anus, almost like for women, a Kegel exercise. You type, and you feel your transverse abdominis tightening. You can put your fingers right next to your hip bones almost, and you feel those muscles slightly tightening, not the ones in the center, not the 8-pack. You may, as you go, the abdomen comes slightly in. Okay, good. And then the other part is I ask them in little, that's one piece. The second is to persuade them maybe how your breathing may not be right. So I ask people, take a big breath. So you take a big breath. I take it like in my stomach. You didn't see my shoulders move. If I turn my camera down or so. But most people will go like this. And then you don't talk about it. You say, what did you experience? Did you feel yourself getting taller, wider? And when the air goes out, do you feel yourself getting smaller, shrinking? And they all say yes. Anybody who says those two yeses are dysfunctional breathers.
Wow, that's super. That's a great screening tool.
Okay, so now going back to slow breathing, how do we teach it? For an instructor, it's an opposite concept doing it lying down versus sitting up, because gravity lying down does the work on exhalation and inhalation takes work, while vertically, almost exhalation takes more work in some sense because you're fighting against gravity. So when you're lying, now I go to lying down. When you're lying down, in somewhat easy practice is I take a 5-pound bag of rice, put on your lower abdomen, and you're lying there on your back. And then when you inhale, you have to push that bag of rice away from you into the sky, which is really activating the diaphragm. That's a muscular activity. And then you don't have to do anything during the exhalation. Gravity will pull and then do it very slowly. Most people try to do much too much. So one is do less. So you practice that a lot. That is in the lying down position. In the vertical position, sometimes what I do is ask people to really exaggerate their exhalation. So you get rid of all the reserve. But what they do is they compress down with their chest. No, I don't want that. Their chest stays relaxed, and then they have to almost pull their abdomen in. So if you put your hands there, so you really, now the diaphragm is not doing anything. It is just relaxing, being stretched more in its dome shape, going up. And then when you inhale, if you could relax all these areas, like there's a big ball with your hands on the side of your lower ribs, you can almost feel them widening, and you feel your pelvic floor, your anus almost going down a tiny bit. Mm-hmm. That could be one. And then the key is to do it slower. So initially, I recommend in training often to use that pursed lip. That I learned it from Jan van Dixhoorn, who I think is one of the most experts in this field in the Netherlands. And that's a pursed lip breathing. Psst. Or any fricative, really psst. So you really feel the pressure. You can, that because of the reflex pattern.
And Erik, is the pursed lip breathing, is it primarily to put a resistance on the exhalation? Or is there any other functions? Is it doing anything else?
What you can observe sometimes if you measure the tension around the lips and the pelvic floor, they co-vary a bit. Okay? And embryologically, they come from the same group of cells. So the cells that migrate that form your jaw, also the symmetry, also form the symmetry in your reproductive system.
Oh.
And so there is a linkage there, and you can sometimes measure it. So, try to do you cannot do pursed lip breathing when you're tightening your anus almost, if you're smiling. And try to do it with your tongue. It doesn't quite work the same way to get the same fricative.
With the tongue?
If you put your tongue against your palate to shut off the air, then
you can't. It's impossible to mouth breathe out with the tongue and the elevated into the palate.
Yeah, but even if you leave a tiny bit open there, what you feel is your anus not tightening up. It almost wants to go down. It varies. But if you do pursed lip breathing by tightening these muscles here, it's much easier. That's a gimmick. Okay? Posture is critical, by the way. People forget that. So if I'm sitting on a chair and my back is curled, I'm slouched, which is the majority of how most people spend most of their lives. We now spend 8-10 hours a day doing Zoom calls, often sitting. And then at home, we sit on our couch, and our couch, by definition, our spine is slouched. We slouch into the couch. When you're in that body position, just put your fingers on the pubis and the bottom of your, the sternum. And if you notice the distance between that, when I'm slouched, it's much less distance than when I'm erect. So for many people, I tell them when you practice initially, put a pillow just sort of where your kidneys are, so you're slightly more up. That allows the abdomen to expand. We also, that's one of the recommendations we do in our book on tech stress, how technology is hijacking our lives. Because when you sit at the computer, you're stuck. And then the key is to do it slowly. Most people try, they go, shh, they're working. No. When we used to do the work with people who had asthma, the key was to be able to get to the place where they could exhale, that's an exaggeration. And then when they could allow the abdominal walls to almost relax more, that the air, they would have the experience that the air was pulled in by itself. It's the total opposite what a person.
So you're having an active exhalation and a passive inhalation, which is typically
the opposite of what anybody else, most people did.
And the other thing is, because normally when we read about this, and normally even during rest, we always expect the inhalation to be active and it's more sympathetically driven. The exhalation is driven primarily by the parasympathetic response, and it's passive. But I was intrigued, you said when you lie on your back, for example, so I have my daughter after coming in there, so you'll see a wave there behind me. You want to say hello since you're here? Yeah. So I'll have to lift her up though.
Well, such pleasure to see you. Gosh, you're so lucky.
Oh, 1 second there. So, yeah, so say for instance, when people are lying on their back then, so you're seeing that the inhalation is active and the exhalation is completely allowing it to happen. But then when we're vertical, does that not same thing take place, no?
No, when you're vertical, think about it. When you inhale, yes, the diaphragm tightens, but if you, let's say, begin with exhaling, that's the opposite side.
Yeah, so
exhale first.
Yeah.
That means your abdomen is pulled slightly in, slightly. The lower ribs are slightly. Now, if you could just relax this, what does gravity do? It pulls this liquid mass, this content, downward, as if it is a piston that's sucking down on the diaphragm, creating more volume in here. You don't have to do almost any work.
With the inhalation.
You do some because the diaphragm tightens, it's dynamic, but much less. And when you look at your daughter, and it's great, especially when she was even smaller maybe, if she sat peacefully, then what you would see is very little rib movement in the upper part. It would be this big Buddha belly in 300, that would move in and out. And as we got to be about 12 or so, we start shifting. We become self-conscious of posture. Your mother tells you, suck your stomach in. You go to ballet. You hold your feet in certain positions. Guys want to become He-Man. They lift their chest up. These are all dyspnetic or excessive tensions, which lead to, over a long time, to chronic harm. Health, breathing, in fact, is never just breathing diaphragmatically. Breathing is appropriate breathing for the task performance.
Yes, yeah. No,
the ability
I get
to shift.
Yeah.
We totally agree.
Yes.
And I want to really support your work. I mean, I think you're the case of nose breathing. Only the literature in yoga has talked about that before, mainly. And Western medicine has been blind to both mouth breathing, as Nestor pointed out, more than anybody else. We pointed out many times in different ways, but not like any in this overt way. What is the function of the nose? As you well know, said many times, it filters, it warms, it slows the flow. And if you look at people with asthma, and that's how we partly started 30 years ago, more than that. People, the trainees about what happens, they would want the gasp of air.
Yeah.
And the moment you do that, it irritates the airways.
But Erik, I was an asthmatic, and I only work in this field because of my own health initially. I came across nasal breathing in 1998, and it wasn't just asthma, because my nose was chronically stuffed up, and we know there's a bidirectional relationship there. If there's a problem with the lungs, it travels up to the nose and vice versa. And because of a stuffy nose, my sleep was impacted. And I switched to nasal breathing, and it made a tremendous difference to my concentration, to my energy levels, to my stress levels, and to my asthma. But then I contacted, back in 2002 and 3 and 4 and 5, our asthma society in Ireland, And I asked him, I said, we have 500,000 people with asthma in this country. Why don't we have a campaign to encourage these individuals to breathe through the nose? And all I received was resistance. And
You
it
have
was,
yes. I mean,
it's everywhere.
yes.
And I cannot fathom it that we have a charitable organization and all of our respiratory consultants, and they're not all like this. We do have a few ear, nose, and throat doctors who are wonderful, and I'm affiliated with them. But in the main, I couldn't help wonder why I, as a youngster, I went to hospital a few times. I went to doctors every 2-3 months. Not one person ever told me breathe through my nose. And it's really amazing stuff, you know, that has happened. But now I'm going to come back to your book here. If ever before, now it's really crying out for functional breathing and for nasal breathing because of the amount of time that people are spending on social media, looking bent over, texting into mobile phones, onto computer screens. And with COVID, you know, before we were talking publicly face to face, and now we are doing it via Zoom. What's your take on that? So you've just written a book. It's published in the United States, is it?
Yes, but it also is available in England and the UK, and I presume Ireland as well. It's technically called Tech Stress, How Technology is Hijacking Our Lives.
Do you have a cover? Do you have the book there?
Oh, sure. I came prepared.
Great. And the intake of it is, it's looking at our life strategies for coping.
Yes. But I want to go back for a moment. I really appreciate, you know, sharing this, letting people know about the book, because I think it's critical. It looks at posture, it looks at breathing, looks at thinking, and our evolutionary traps as well. I think those are important ones. Going back for a moment to asthma, because I think it's critical. It is a conceptual framework. We are so focused on the genetics. That's family history. We're so focused on the biochemistry, because that's where the money is for drugs. I hate to say it. Mm-hmm. And then to teach breathing or correct breathing, from my part, I would say you want to teach very slow breathing with more complete exhalation, so you can do it, without the neck and shoulders involvement. And I would totally agree, breathe through your nose and exhale through your nose, because when you do that and you do larger volumes, you're slowing down the flow, you're getting more sympathetic, parasympathetic balance, although how it all works is not always as clear. But it clearly works. It should be the first intervention. There's only one problem.
It doesn't make money.
It's not just doesn't make money. It takes time to teach. As you well know, my guess is, at least in my experience, some people I can do in a half an hour to get the concept. Others take 10 or 20 sessions.
Yeah.
And then they need to practice this, the kind of learning. The people, let me put it this way. If you want to learn to play the violin or basketball, but let's take a musical instrument, you hire a coach or a music teacher, you go to the class once a week, and you practice sort of daily with intent. If you don't practice with intent, your parents are wasting the money. But you practice. And then after a couple of months, you can play some simple melodies. And after a couple of years, you can do pretty good. You do recitals. And eventually you get so good that when people laugh at you, you can still play. Mm-hmm. You have to generalize the skill. People think that breathing should just be, okay, I now have taught you breathing, go home. They forget that breathing is conditioned and embedded in all our movements of our lives. If you take a person, say, stand up, as the listener, just stand up for a moment. In most cases, especially if you have pain, you just held your breath. You anticipate, you didn't know you did this. To solve that, all you need to do, which we found out with our yogis when we studied with pain control, what you do is you inhale in your abdomen and then start exhaling. And then in the exhalation phase, do the movement that may hurt or do something. The pain is usually much less. It's 50% less.
In the inspiratory, was it the inspiratory apnea? But there's also another thing about pain thresholds. Hyperventilation increases pain perception, reduces pain thresholds. Like, I find that this is crazy stuff, because can you imagine somebody in chronic pain?
They're breathing here.
And they're going to be anxious. And that, as a result, is going to cause chronic hyperventilation in the long term because of the chronic pain, which in turn is contributing. It's the central nervous system is becoming aroused. Pain thresholds are lowering, pain perception is increasing, muscle tension is increasing, and it's a vicious circle. And it could be, and I understand, I get the point. It does take people time to teach them.
It should be the first thing that should be done.
But it's worth it.
I totally agree. It's like, from my perspective, anyone with asthma, anybody with GI distress, many of these kind of functional disorders, the first thing they ought to be learning is a combined stress management that includes, I would say, effortless breathing. I'll call it effortless breathing. And if you observe almost all of them, their breathing pattern is dysfunctional. And when the breathing pattern is dysfunctional, your hormones become dysfunctional, your whole system becomes dysfunctional. The challenge is usually, it is not quickly shown. That's why we do these little exercises to show how quick the effects are. Let me just show a different one, how body affects you, because this is critical in terms, especially of cognitions. We now have an epidemic, I would say, of people, especially with online learning, of people feeling isolated, lonely. And there's an increase, ever since we started with the iPhone, among students, of increase in anxiety, depression, and suicide. You know,
more so in females,
yes,
which wasn't happening before. But you can kind of understand it though. Like, I'm nearly 50 years of age. If I go in on Instagram and I see all of these beautiful bodies, because to me they're the only people who pose on Instagram. You know, you have a nice body, you've got a six-pack, you're a man, you want to show it, you pose it. But I don't really care about how it is, you know. I'm nearly 50, I don't care. So if I was younger, if I was in my 20s and I'm really body conscious image and you're trying to make yourself look attractive to girls, there's an awful lot of pressure on people with social media. And it also gives us a one-sided view, because all we're seeing is good-looking people with good bodies, and it's not a reflection of reality, but to the young mind, it is, and it makes them feel insecure. And I remember, I'll come back to you in a second, I remember listening to this interview by, I can't remember who he was, but anyway, his point was, he said, look at the individuals who founded social media. They were nerds, they were social recluses, they were asexual. And he said that their typical behavior pattern, it's almost that it's being transmitted throughout social media, that the users who are spending so much time, that it's almost that it will contribute to them turning into nerds, asexual, because how can you have a girlfriend or a boyfriend if you can't even communicate with them, if you're looking into a screen? You know, so there's some truth in it. I really think that there's something here that we have to start shouting about, and that's looking at the effect of tech on anxiety levels.
Let me add one interesting part, since I live near the tech bubble in Silicon Valley. Many of the people who were the developers of the programs, whether it was Steve Jobs, he did not allow his own children to use the iPhone or anything like this. He limited. Bill Gates set massive limits on his own child, on his daughter, when she got caught by the digital media. He put massive limits on. Many of the high-tech people, the young people in Silicon Valley who helped develop Facebook, Instagram, their own children are not allowed to have cell phones or digital media. You know, they have no cell phones till age 14 or 16.
Yeah.
The total opposite.
Yeah.
The highest concentration of Waldorf schools, which is a kind of unique German model school where you don't use any tech in the world, is found in Silicon Valley. And it's all private schools. So it says something what people do know. And so let me give a kind of interactive piece of just sitting, which you can argue is so harmful. So one, in sitting, it's probably it is probably the disease that's the upcoming disease.
Mm-hmm.
For
as
we
bad
know
as
sit
bad as
all
smoking.
Yes, it's called but let me just, when you sit, what we forget is we are collapsing, most of us. Very few people sit up, right? Now what happens, I get involved, and when I get involved, I give my covert startle response. I'm reacting to the stimuli of the screen, and all these stimuli, all these notifications are designed for only one reason: to capture our attention. They don't care what we see or what we do. It's the monetization of our attention. The way I do this, I give you enough stimuli. And what makes that different than in the past, when you were a student, or me was a student at school, even if the material was boring, I had to direct my attention to the material to master it. Now, it is the stimuli which evokes our early survival patterns that activate our attention. You give me a change, I look at it. Just look at movies, we can see this. Look at a movie of the 1950s compared to a movie now. My God, is it slow? Especially those British ones. No, I'm sorry. But it isn't slow.
Yeah.
It is that we are now so trained to only orient toward. Let me give two examples in this. If you, totally out of the way, if you go to Midway Island in the Pacific, 2,000 miles away from anywhere else in the world, there are these great birds, it's called albatrosses, that nest there. You go along the beach and you see all these dead albatrosses. You see their skeletons, you see their feathers and the skeletons. All the flesh has been digested, eaten up, and what is left is what was in the intestinal tracts, all pieces of plastic. Now what happened? These birds fly over the Pacific, and for essentially for survival, the ones who could identify some shimmering object in the water and could capture that and eat it, that used to be a fish, they would swallow it and then regurgitate it to their chicks. Now, the ones who did that best survived. Now they go over the Pacific, they see this shimmering object, they take it in, it's coated with algae, except it's a piece of plastic. Yeah. They now eat it, they digest it, so they don't get nutrients, they don't feed their chick, and many of them die. Yeah. Do we blame the albatross because it's so stupid to not be able to discriminate? In many ways, social media is doing the same thing. It is giving us these cues, which we, as we are wired to react to survive. And once we understand that, then we have to say, we need to do something different. Yeah. So let me now apply that same thing for sitting. So when I sit, my body basically says, I need to go rest. Now I have a conflict because my brain is active. But I'm sitting, and then I slouch. The moment I slouch, and I don't know it, I'm decreasing the ability of the diaphragm to really descend. It can't. It's just pure biomechanics. And we describe that and show illustrations in our book very well. And that means I have to shallow breathe slightly more, which I do. I don't know I'm doing it. When you measure people at the work site, their PCO2 tends to be slightly lower because they're doing shallow, rapid breathing. So they're almost chronically hyperventilating, although it's not called hyperventilation. But it's much more subtle than this. When I slouch, I put my body in a position of defeat, hopelessness, and powerlessness. Without knowing, I don't know I do that. But let's do it as an experiment. I'll only give the steps. I recommend that the listener practices this, and I can promise them that they'll be like almost everybody else. We have published this data. So if you now slouch, look down. While looking down, just evoke only hopeless, helpless, powerless, defeated memories, one after the other. Just do this. So you evoke those, keep in this slouched head down position, hopeless, helpless, powerless, defeated memories. You do this for 30 seconds. After 30 seconds, you don't change your position, but now you evoke only optimistic, empowering memories, one after the other. So now in this same collapsed position, evoke optimistic, empowering memories. Do that for 30 seconds.
Mm-hmm.
Now shift up, look up, make yourself tall. And now, while looking slightly up, evoke only helpless, hopeless, powerless, defeated memories. Keep doing that for a while, for 30 seconds. And then shift and evoke only optimistic, empowering memories. Do it for 30 seconds. And you do all the appropriate controls. Good enough. And what most people report, you may have even experienced that in the I suspect that in the slouch position, it's easier to evoke the hopeless, helpless.
Totally.
But
no question. When you're standing up and looking, well, even forward, and you're doing it, even though you can bring them into the mind, it doesn't have the same impact on the body.
Yes, you got it. It is so impressive. So when you're up, you think of the hopeless memory or your defeat. You're often more distant.
Yeah.
And what is more interesting when we look at brain research on this, you're collapsing. You think positive memories. The brain literally, it's the work by Yimei Lin and my collaborator in Taiwan and me. You look at their brain, and their brain just has to work harder.
Yeah. No
wonder people get more depressed. I sit here, I don't do movement. And we know that probably the best treatment for my bias for depression is exercise and movement, being outdoors in controlled studies or long-term benefits. You don't do movement, that reduces that already, gets you more at risk for depression or to get out of it. Then you put your body in a position in which you're powerless, and just like the exercise we talked about before, it is a conditioned cue for the body to associate these negative memories. They start overwhelming. And now imagine if you had a history of depression, this amplifies it more. It's harder to get out of that position. No different. And your breathing is compromised. When you're up, it doesn't mean when I am erect and tall, I have the opportunity to breathe more correctly. It doesn't mean I will. But when I'm slouched and collapsed, I do not have the opportunity to do it. Which do you want to do? When we do the same studies, by the way, and that applies very nicely in also with breathing, you can have people do mental math. I did this with my colleague Rick Harvey. And all you do is you do mental math in these different positions. And you see that it's harder to do mental math when you're slouched than when you're sitting up. It's unbelievably different.
Why do we do exams sitting down and we should be doing them standing up?
Or now what I teach my students is to change their position first. When they have a hopeless, helpless thought, which are like this, oh my God, I can't do this paper. I can't write, and no, I don't know the answer. Stop, take a breath, sit up, take a breath, look up, and then return to it. It's a very simple trick. And when you do that, you practice it. It is not that it will work the first time you do it often. It takes skill and mastery. But if you practice this, it is totally different because you're not just communicating to the world outside you how you are when you breathe easily, that you're secure, you're comfortable. You are cueing your own body and changing its own physiology. And to me, that is the critical part as well.
That's super. And I really enjoyed it. In terms of the conversation, there's a lot of amazing points here. And I am going to read your book, by the way. So I'm going to check it on Amazon. And I'm intrigued, and I will encourage people as well who are listening to it to read it again. So it's called Tech Stress. And it's an amalgamation of posture, breathing, and technology. So I think the time is ripe. The time is ripe, and you see it there with the blue color. Now, the cover may be slightly different here in the UK or in Ireland versus the United States. Dr. Peper, it was a privilege. Thanks very much. I enjoyed the conversation immensely. And Yeah, it's great. Super.
Patrick, I really appreciate it. And I think the work that you have brought to the world of focusing on breathing